So hi and welcome to my channel. So the UK Health Security Agency is issuing a warning to parents with children in the UK. This is because scarlet fever has actually caused the death of 7 children so far in the UK this year. This is so unfortunate because we know that, one death is too many and this should not be happening. So basically in this video, I'm going to be telling you what is scarlet fever, what are the symptoms to look out for, what to do if you notice any of these symptoms, and how to seek help, medical help. What do you actually do as a parent? So this is a time to be very, very vigilant because this, scarlet fever is highly infectious. So what is scarlet fever? So scarlet fever is normally caused by group A streptococci. So basically, this is a bacteria infection that affects children. It is highly infectious, which means that if a child has it and they go to school, for example, they're likely to spread this particular bacteria to their other classmates. So, this bacteria normally has flu-like symptoms, and that is why it is so challenging, because as we know, with flu you don't necessarily need any medical treatment. The child just needs that TLC, tender loving care, and they'll be fine. They don't need antibiotics as well or medical treatment. But because this scarlet fever is a bacteria, the children normally would need antibiotics, for it to go away. So this is why it's been so challenging for parents to be able to spot the difference and say, one, is it scarlet fever, or two, is it just normal flu-like symptoms? Because as you know, when children are going to school or nursery, they end up with all sorts of flu-like symptoms, and as parents we can sometimes just think, oh, this is flu. So this is a time to be very, very vigilant, because unfortunately the number of cases has increased drastically, and in England alone so far this year there's been over 4,600 cases, with 851 cases being reported in a single week. Just to put this into context, usually there's just about 186 cases. So there's, this drastic increase has unfortunately also been linked or led to an increase in the number of deaths, which again is very, very sad. So what are the symptoms to look out for if you're a parent? So the symptoms to look out for, the first symptom is a sore throat. So if your child is especially under the age of 10 and they're complaining of a sore throat, you need to take that very seriously. Try to have a look, make sure that you get medical treatment. Then the second symptom is if they have a fever. As a parent, it's always a good thing to have a thermometer at home so that you can check the children's temperature very frequently. And look, it is something that you have to keep on checking continuously to make sure that they haven't got a fever, because when children have a fever as well, the temperatures are usually higher than the temperatures in adults. So again, you need to be really, really aware. Temperatures can get really high in children. So fever. And then also the next one is a headache. So if the child is complaining of a headache, you need to take that very, very seriously. The worst is if they have a headache, they have a sore throat and they have a fever. Those are already 3 symptoms of scarlet fever. So again, the more the symptoms they have, the more concerned and alarmed you should be as a parent. Obviously, the younger the child, the more concerned you should be as well. So that's those are the 3 symptoms. Then the fourth symptom is a rash. If a child has a rash that is reddish in color, a bit pinkish, you need to be concerned. Again, rashes in young children is always a cause for concern if the child doesn't have any, allergies, or if it's not eczema. So, if you are a parent, you need to look out for those rashes. Again, if your child is black, it can be more difficult to spot that rash, so you need to be more careful. When you're looking, you need to be more vigilant. But what you can do is, if you kind of just scrub your hand on the child's skin, it's gonna feel like sandpaper. So it's gonna have a really funny sound like sandpaper in black children. So again, if you need to be more vigilant when you're checking. So now, what do you do if you actually notice any of these symptoms, or if you're concerned as a parent? You need to ring 111, NHS 111, or you need to ring 999, or you take the child to A&E. So these are the 3 options, or you go to the GP, but don't do nothing, because like we say, the severe cases of scarlet fever have increased drastically. And unfortunately, of these children that died, 5 of them died within, 7 days of being admitted into hospital with the severe cases of scarlet fever, which, it is so heartbreaking, obviously, as a parent, for something like this to be happening. So the treatment for this, like we've said, if you go to your GP, or you ring 111, or you go to A&E or ring 999, what's going to happen is that you're going to be given antibiotics, because scarlet fever, like we've said, is caused by the group A streptococci, which is bacteria. So to treat bacterial infections, you need antibiotics. So when your child is given these antibiotics, you need to make sure the child is isolated at home. Don't send the child to school or to nursery, or take them out playing, to cinemas, to supermarkets. If you're alone with the child at home, you don't have anyone else living with you, it's best to get a friend, get a neighbor, get somebody to help you do the shopping and drop at home, so that the child stays isolated. Because if they go out, they're likely to spread the infection, because like we've said, it is highly infectious. So you want to contain it, in that state, and have antibiotics, so that hopefully it doesn't progress to the advanced stages. And advanced stages, the child would have pneumonia, which pneumonia, it's just a chest infection, but in children, it can be very, very severe. Or in the worst case scenario, the child can have sepsis, which again, is a blood infection. When, this bacteria actually goes into the blood, that is what is called sepsis. So it's very, very serious. And if the child ends up with this severe case, they have to go to HDU. So that's a high dependency unit, or intensive care, where these children have to be intubated, which again, being on a ventilator, imagine a child under the age of 10. So as a parent, please, the UK Health Security Agency is urging parents to be extra vigilant, extra careful, because there are so many cases right now, and these cases are abnormally high this year. They're still investigating why the cases are so high this year. But in the meantime, all we can do is just to make sure that we're following these guidelines. You're looking out for symptoms, and you're escalating appropriately without necessarily minimizing these symptoms. Again, as a nurse myself, as a parent, I'm a nurse prescriber. I'm always the first to say to parents, look, you don't need antibiotics for XYZ, because anytime that a child has flu-like symptoms, parents always want to have antibiotics. But in this case, if you're not sure, you need to escalate it. Go to the hospital, see a doctor, take the child to A&E. Don't minimize the symptoms just because of these extra symptoms that it can cause. Look at, especially for the rash that we've said, sore throat. That's the first symptom that most of the children complain about, is the sore throat. So if your child is under the age of 3 months, for example, what do you do? Because these are very fragile. In fact, these are still babies. So if your child is under 3 months, what you can do is, if you notice that the child hasn't passed any urine, or they haven't opened their bowels in, say, 12 hours, that is a cause for concern. So you need to take the child to A&E, or the baby, obviously, because it's under 3 months, to A&E. If you also notice at a very, very high temperature, in a baby under 3 months, you need to take them to A&E as well. If you also notice that they're not really feeding as they would normally do, again, it doesn't matter whether they're bottle feeding or breastfeeding, you need to make sure that you're escalating that immediately, because again, those babies are not able to talk to you. So you need to find a way of identifying that they are unwell, because obviously the younger the baby, the more severe the symptoms are likely to be. And like we're saying, ordinarily this scarlet fever just causes mild flu-like symptoms, but obviously this year, for whatever reason, the cases are getting more and more severe. Not only the increase in the number actually, but more children, over 500 children in England, have actually had the severe case. So that is an exceptionally high number, and it is important that parents are extra vigilant, looking out for all these symptoms. I'm also going to leave a link to all of this in the description box below, so that you can go through the information as well. Just make sure to share with other parents, so that they're aware of what's happening, because I know life can sometimes be very busy, and we don't really keep that close eye on children as we should do. But really, this is the time to be looking out for those symptoms, asking the children, how do you feel, how are you doing, and just trying to preempt those symptoms. If a child is obviously really young, especially if they are going to school or they are going to nursery, because like we've said, children under the age of 10 are actually more susceptible to this particular virus. So, and because of the flu-like appearance of the symptoms, it can be incredibly challenging for a parent to really spot it and be able to differentiate whether it's scarlet fever or just ordinary flu. Again, isolation is key. Medical treatment, prompt medical attention is key, because if you treat scarlet fever promptly, then it's going to reduce the chances of it actually leading to that pneumonia or sepsis. So please, just look out for this. If you're a parent, anybody who's a parent, share this with them. Subscribe to the channel, because if there's any news or anything like this, I'll make sure I bring it to you so that you're informed, you're aware of what's going on, and you can also help to tell other parents. Because like I was saying, as a nurse practitioner myself, this is something that when I saw, I was like, oh my god, this is really, really alarming. Because especially because we constantly say to parents, oh, your child doesn't need antibiotics, because parents naturally, the feeling is that they think children need antibiotics for everything. But I think this is one of those times, obviously, where it's good, it's important to differentiate whether it's bacterial infection or a viral infection, and make sure that those antibiotics are taken, by the child, and that they are kept isolated so that it does not spread out, because it's highly infectious. Thank you for watching the video, and please do share this with other parents so that they are informed and they can know exactly what's going on. Thank you so much for watching.